Hi everyone, welcome to the Spoony Life and Beyond. My name is Sarah and today we are doing an awareness post that has been requested by one of our members, and it is on celiac disease. So just letting you know that I am actually blind. I may not always look at the camera and I do go from text to speech, so sometimes I may stumble a little bit. This is also not for medical advice, it is for awareness purposes only and to help break stigmas. So let's go dive in and let's learn about celiac disease. So celiac disease is an illness that's caused by an immune reaction to eating gluten. So gluten is a protein that is found in foods containing wheat, barley or rye. So if you have celiac disease, eating gluten triggers an immune response to the gluten protein in your small intestine. So over time, this reaction damages your small intestine's lining and prevents it from absorbing nutrients and conditions a condition called malabsorption. So the intestinal damage often causes symptoms such as diarrhea, fatigue, weight loss, bloating, anemia. It also can lead to serious complications if it is not managed or treated. So in children, malabsorption can affect growth and development in addition to gastrointestinal symptoms. And there's no definite cure for celiac disease. So for most people, following a strict gluten-free diet can help manage symptoms and help the intestines heal. As mentioned before, there are symptoms to celiac disease and they can vary greatly. So they may be different in children and adults. Digestive symptoms for adults include diarrhea, fatigue, weight loss, abdominal pain, bloating and gas, nausea and vomiting and constipation. However, more than half the adults with celiac disease have symptoms that are not related to the digestive system. So there's anemia, so that's usually from iron deficiency due to decreased iron absorption. There's loss of bone density, so there's osteoporosis, a softening of the bones called osteomalacia. There's itchy, blistering skin rashes called dermatitis herpetiformis. I apologise. There's mouth ulcers, there's headaches and fatigue, nervous system injury including numbness and tingling in the feet and hands, possible problems with balance and cognitive impairment, joint pain, reduced functioning of the spleen, known as hyposplenism, and elevated liver enzymes. So there's just so much that could be going on, and it's not just in the intestinal tract. And with children with celiac disease, they're more likely than adults to have a digestive problem, including nausea and vomiting, chronic diarrhea, a sore belly and swollen belly, constipation, gas, pale, foul-smelling stools, and also inability to absorb nutrients that might result in failure to thrive for infants, damage to tooth enamel, weight loss, anemia, irritability, short stature, delayed puberty, and neurological symptoms including attention deficit hyperactivity disorder known as ADHD, learning disabilities, headaches, lack of muscle coordination, and even seizures. So there's also dermatitis. So for the dermatitis herpetiformis, it's the gluten intolerance that can cause a blistering skin disease. So it can occur on the elbows, the knees, the torso, the scalp, the buttocks. It can cause so many different symptoms in so many different people. They say that when to see a doctor, consult your health healthcare team if you have diarrhea or digestive discomfort that lasts for more than 2 weeks. Consult your child's healthcare team if your child is pale, irritable, failing to grow, has pot belly, has foul smelling bulky stools. So just really keep an eye out. If anything seems not right, just go get it checked out. And there's nothing wrong with writing down what's been going on as well, so you don't forget anything, or you write down any questions you want to ask. So the causes, so your genes combined with eating foods with gluten and other factors can contribute to celiac disease. However, the precise cause actually isn't known. So infant feeding practices, gastrointestinal infections and gut bacteria may contribute, but these causes have not been proved. So sometimes celiac disease becomes active after surgery, pregnancy, childbirth, viral infections, and severe emotional stress. So when the body's immune system overreacts to gluten in food, the reaction damages the tiny hair-like projections called villi, and that line the small intestine. So villi absorb vitamins, minerals, and other nutrients from the food. And if your villi are damaged, you can't get enough nutrients no matter how much you eat. So the risk factors for celiac disease tends to be more common in people who have a family member with celiac disease or dermatitis herpetiformis, type 1 diabetes, Down syndrome, Williams syndrome or Turner syndrome, autoimmune thyroid syndrome disease, microscopic colitis, Addison's disease. So there are complications, and they are likely to be malnutrition, bone weakening, infertility and miscarriage due to the malabsorption of calcium and vitamin D, which can contribute to reproductive issues, lactose intolerance, cancer, nervous system conditions. So it's something that you really want to keep on top of and just make sure you know that everything's going okay. Like I said, if there's any changes, seek medical advice. So there is non-responsive celiac disease. So some people with celiac disease don't respond to what they consider to be a gluten-free diet. So non-responsive celiac disease is often due to contamination of the diet with gluten. So working with a dietitian can actually help you to learn how to avoid all gluten. And it's really important as well when you go out to be cautious of cross-contamination as well when eating with others, when there's foods with gluten and foods without gluten. So just being really mindful of cross-contamination because it can cause all serious things like bacterial or overgrowth in the small intestine, microscopic colitis, poor pancreas function, irritable bowel syndrome, difficulty digesting sugar found in dairy products, so lactose, table sugar, so sucrose, or a type of sugar that is found in honey and fruits, so fructose. So truly refractory celiac disease that is not responding to a gluten-free diet. So refractory celiac disease, in rare instances, the intestinal injury of celiac disease doesn't respond to a strict gluten-free diet. So this is known as refractory celiac disease. So if you still have symptoms after following a gluten-free diet for 6 months or a year, you should talk to your healthcare team to see if you need further testing to look for explanations for those symptoms. So many people with celiac disease don't know they have it. So 2 blood tests can help diagnose it. So there's serology testing, which is looking for antibodies in your blood. Elevated levels of a certain antibody protein indicate an immune reaction to gluten. And then there's also genetic testing. So the human leukocyte antigen HLA-DQ2 and HLA-DQ8 can be used to rule out celiac disease. And it's also important to be tested for celiac disease before trying a gluten-free diet. So eliminating a gluten from your diet might make the results of blood tests appear in the standard range. If the results of these tests indicate celiac disease, one of the following tests will then likely be ordered. So the endoscopy, so they'll go in, have a look, with a camera, do a biopsy and actually have a really good look. And it also helps to analyze any damage to the villi. And then there's also a capsule endoscopy where it's a wireless camera to take pictures of your entire small intestine. So you swallow it, and as it goes through, it takes pictures. If you might have dermatitis herpetiformis, your healthcare professional may take a small sample of skin tissue to examine under a microscope. If you're diagnosed with celiac disease, additional testing may be recommended to check your nutritional status also. So this includes levels of vitamin A, B12, vitamin D and E, as well as mineral levels, hemoglobin and liver enzymes. Your bone health also needs to be checked, so a bone density test, just to try to rule out any osteoporosis, weakening of the bones. So the treatment for celiac disease is a lifelong gluten-free diet. The only way to manage celiac disease is by eating strictly no gluten. So besides wheat, foods that contain gluten include barley, bulgur, durum, farina, grain flour, malt, rye, semolina, spelt, which is a form of wheat, and triticale. You can work with a dietitian who specializes in celiac disease, and they will be able to, help make a plan moving forwards. If you're finding it hard, you can go back and have a chat about it and see if, you can write up a diet to start with, and any tips and tricks to avoid cross-contamination. So removing gluten from your diet will typically reduce inflammation in your small intestine, causing you to feel better and eventually allow your intestine to heal. So children tend to heal more quickly than adults. So generally there will also be some vitamin and mineral supplements added as well, and a lot of follow-up care just to make sure that everything's going okay, there isn't too much malabsorption, making sure that there's enough vitamins and minerals being added, and just checking any inflammation markers and things like that. So there is a lot to it. There's, shopping, you have to read all the labels just to make sure, because you'd be surprised what gluten is actually in. So just things like that, like even going to the pub, a lot of beers, a lot of alcohol has gluten in it. It's really difficult. So going to see a dietitian that specializes in celiac disease is really helpful, because then you get to know really what to avoid, and at home what you need to get rid of, etc. So it is really beneficial. So there are so many alternatives, and at the shop now the gluten-free food has really improved over the years. And quickly before I end this talk, I also want to go into the stigma around celiac disease quickly. And that is because what happened was, when people started finding out about celiac disease and people started getting diagnosed, other people started wanting to follow a gluten-free diet as well. So unfortunately, people who truly have gluten-free diets because they have celiac disease will go to restaurants and they will be judged, and people will do gluten friendly, and celiacs can't have gluten friendly because it's not a slight intolerance. It actually causes physical damage, and they can't have any gluten at all. And so there was a fad that happened where people were just like, I'm eating gluten free. So places started doing gluten friendly, or you would go into restaurants and people would get cranky if you tried to order something gluten free because they were sick of being asked for gluten free food. So I want people to really know that celiac disease is serious. It is real. Damage can be caused. So when somebody walks in somewhere and says they are celiac and they need gluten-free food, it is real. They do actually have a disease. It's called celiac disease, and it does literally cause damage to their body if they eat gluten. So please really take that in when you go out and you hear somebody say, I'm celiac and I need gluten-free, not gluten-friendly. Before you judge or make a comment, please do remember there is a difference between somebody who has a gluten intolerance and somebody who has celiac disease. There is a big difference. So please, we need to take the stigma away, and we need to take that judgment away. So thank you so much for listening. Please do know that you are the first people to actually receive this video. So keep following our Discord. Keep following our Patreon, because there's going to be more, and it's going to be great, and we're all going to learn together. We're going to break stigmas. We're going to support each other. We're going to have fun. Come over to the Discord. There's a link in the Patreon. Come over. Keep watching the videos. There's going to be other things. There's going to be Q&As. There's going to be interviews. So come on over. But thanks for listening, and I'll see you in the next video. Mwah.